Hello, I'm Helen Bristow and I'm meeting with presenters from the ASCP annual meeting 2024. And today I'm happy to be talking with Liron Pantanowitz.
Hi, everyone.
Please would you introduce yourself?
Yeah, hi, everyone. Thank you, Helen, for inviting me to talk to the pathologist. I'm the Maud Menton Professor of Pathology and also the Chair of Pathology at the University of Pittsburgh in Pittsburgh, USA.
And could you give us a summary of the presentation that you gave at the ASCP meeting?
Yeah, on behalf of ADASP, which is the American Directors of Anatomical Surgical Pathology, but it includes more than just directors of surgical pathology, it's directors of many different areas in anatomical pathology. We had put on a companion meeting at the ASCP, and we had picked a relevant topic where a lot of directors need to make decisions to run labs for many different reasons, and data is crucial to that. And so we had put on a companion meeting that was relevant not only to directors, but to all pathologists. And the talk we gave was a data-driven decision-making in pathology. And I gave that talk along with Professor John Sennard from Yale University.
Why is that a topic that's important to you?
Well, Helen, the topic's important to me, and it should be to all pathologists, because one of the things we do every day in our jobs is generate large amounts of data. We generate a lot of data about patients, and we occupy 70 to 80% of all the data in an electronic medical record. But in addition, we produce lots of operational data, lots of transactions, and there's a lot of raw data that we don't even share with many other people in the health system. Now, pathologists know, and the people they work with in the lab, that all that data is often locked into some sort of legacy lab information system. And so it's very hard to get that data out. And the talk we gave is why it's important to make the effort to try and unlock your data so that you can mine it, analyze it, and then make a data-driven decision. And that is to avoid the trap of when you're forced to make a decision about an operation or about personnel or resources, you don't just go with a gut feel, but you make an informed decision based on the data you've seen there. The other thing why it's worth putting in the effort to do that is, besides the benefit to your own lab, the impact that it can have and the value it brings, is pathologists are great stewards of that data for their institution. And if you not only utilize the data yourselves, but share it for the benefit of wherever you're practicing, so that others can also make data-driven decisions, you'll be seen as an excellent steward and bring a lot of value to the system. And the best time where we saw that actually play out was during COVID. Many facilities, hospitals, organizations needed to know what was going on with COVID, how many people were testing, how many of those people were positive, so that they could make decisions. And the lab was the place that owned that data. And if you provided it in a dashboard form for leadership in your organizations, well, you then brought a lot of value to the organization. And that's kind of the message Dr. Sennard and I wanted to convey to people, plus the principles of doing it, the difficulties of doing it, because it's never that easy, and then some of the applications so that they could, go back to their labs and, make data-driven decisions.
So could you give us a practical example of a data-driven decision that might be made day-to-day in the laboratory?
Yeah, well, I presented 4 key scenarios in which pathologists and people working in pathology labs should be able to leverage their data. And then Dr. Sennard followed on with 30 minutes of a deep dive into some sort of practical applications he did at his own institution. And so the number one thing is, whenever you need to make a decision about your resources and operations, sort of, should you be hiring people? How many FTEs do you need to hire for a particular facility or a particular division? If you manage the data well and are able to analyze that. So for example, let's determine that RVUs are of value. Well, how many RVUs does this division generate? How many FTEs do they have? And then when you reach a certain threshold, I need to hire another pathologist. I gave 3 other examples, one about, staff productivity and performance. People like to get feedback. And so they like feedback together with data. We use it for QA programs, and we gave some examples. And anytime you have to make a business-related decision, and I do a lot of those tasks as the chair, so I like to rely on data to make business decisions.
Thank you for that. And let's talk about scientific meetings in general. Why do you think it's important for laboratory medical professionals to get out of the lab and go to these types of events?
Great question. I think it's important to, number one, disseminate information. And it's always a little bit better in person than it is sort of in a journal article. I encourage people to go and participate in person or virtual. But besides just disseminating information and getting updated and having an open discussion, sometimes controversial dialogues about where the field is moving and new classifications out there, I think it's imperative for us to network with colleagues. A lot of creative ideas happen when you go to meetings and you network with people. They help you further your personal career. Besides, they also help advance the science. And I also think a healthy balance between work and play is also good. And so getting outside the lab once in a while, even if it's virtually, taking a break from your own environment to connect with colleagues in a different environment and enjoy and share the science, makes pathology much more enjoyable. And so I always enjoy going to meetings, not only for the reasons I mentioned, getting myself updated, sharing knowledge I've learned, connecting with colleagues, but just to get a break from, my routine daily, job.
Absolutely. A change of scenery is always very refreshing. So thinking about all the conferences and meetings you've attended over the years, is there anything in particular that was memorable?
I think, Helen, the first meeting that was memorable to me, I enjoyed all my meetings and I probably remember them all, but the first one that really struck me as this is a privilege to be able to do this, especially coming from an academic environment where, I travel to a lot of meetings, was my first post-COVID in-person meeting. We had taken meetings, I guess, for granted. And then when COVID shut down the whole world and we were forced to stay home and then figure out how to, continue with our meetings in a virtual environment. And then we slowly transitioned to a hybrid environment, which has stuck. But now we're back to, in-person meetings. And my first in-person meeting again, I was thrilled to be able to, see people in person, actually witness not just facial expressions, but the way they use their hands when they're giving lectures and, be able to connect, take a coffee break with colleagues. So that was probably the highlight of my post-COVID meeting experience.
Absolutely. That's a great answer. It's been really interesting talking to you, Liron. Thank you very much for joining me today.
Thank you, Helen.